So, hi everyone. Hope you are all well, and welcome to this talk on top tips in cardiology. This talk, in fact, the idea from this talk was because we got a lot of questions from general practitioners, and most of the questions, they end up being the same. So I kind of put them together, and I decided to do a few topics on those questions so I can help as much as I can through these talks. So pretty much this talk will be divided in three, and you'll be basically focused on approach to heart murmurs. Today's talk will be basically on approach to heart murmurs in puppies. Then another day, we're going to discuss on how to approach a heart murmur in an adult or geriatric small breed. And then finally, we're going to discuss how to approach murmurs in adult cats. So these are very frequent questions that we usually get, and I'm going to give you my approach, okay? It might be different from cardiologist to other cardiologists, but this is what we tend to advise when we are asked what we should do with this patient that just arrived to us and there is a murmur that I have picked up. So let's then start. We're going to start with the first topic. So how should we approach a puppy that arrived to the practice and we found out that there is a heart murmur? Before we even discuss about giving you the tips, I think before that we need to go through a few background, really. So there's a bit of nomenclature that we need to know. So we have what we have heard probably already many times, the non-pathological heart murmurs, okay? And these non-pathological heart murmurs, in theory, they can be divided in two types, okay? The functional murmurs, okay? They are related with hyperthyroidism, anemia, hypoproteinemia, pyrexia. Let's say if a patient, sometimes they can get murmur if it's a female dog that is pregnant, for instance. And then we have also the innocent murmurs, which are pretty much the ones that we have done our workup and we have not found the reason. Then we have the pathological ones, as the name says, basically is when we have identified a pathological reason, a heart disease that can justify the heart murmur. And obviously the ones that we might need to remember more, mostly in UK, because we know which are the most common in our country, in UK, are PDAs, pulmonic stenosis, aortic stenosis, and ventricular septal defects. These are by far the most common congenital diseases that we do see in UK and very likely in other countries as well. The problem here that sometimes can create some confusion is that a lot of times the term innocent and functional, we use these terms basically to mean the same thing. Okay, so that can sometimes create some confusion. But if you use a review paper on how to approach murmur in puppies and kittens, there is these definitions that we can go there and look. Okay, the difference between functional and innocent. Okay, but both of these type of murmurs, they are non-pathological, so they are not associated with a structural heart disease. It's also very important to know that around, well, not around, is in fact one in each 4 puppies can potentially have innocent or functional heart murmur. So that's quite important to know that we will probably see a lot of those murmurs that are in fact non-pathological. And then it's also quite interesting to know that pretty much up to 8.5 puppies, 8 puppies and a half in each 1,000, might have congenital heart disease, okay, so which will lead to a pathological heart murmur, most of them. So this is important because the incidence of congenital heart disease is not as low as you may think. Now, I'm going to just discuss here how we should classify murmurs, okay, just to make things a little bit more easier in a few slides and down the line. So you probably learn in university to classify the murmur intensity in a scale between 1 to 6, okay? They are trying now to simplify the way we classify murmurs and in a more simple way. So the new scale that has 4 degrees of intensity is using the term soft, moderate, loud, and thrilling, okay? So I'm going to just explain how I used to teach vet students in identifying the severity, the intensity of the heart murmur using the scale 1 to 6. So because then it will be easier to explain the next classification. So basically, I used to say that if you have a murmur that is as loud as the heartbeat, okay, S1 or S2, I would call it, a grade 3 out of 6 heart murmur. If it's quieter, that will be grade 2, and a grade 1 is the one that you thought you have detected, and then you cannot detect again, and then you try again, and you might heard it for a few seconds, and then you miss it again. So it's a really, really quiet one that is quite challenging to identify. And then we have the grade 4, okay? So if the grade 3 was as loud as a heartbeat, the grade 4 will be louder. Then we have the grade 5, which will be the one you get a thrill, okay? So in fact, you'll have a kind of a vibration over the region where the murmur is louder. And then finally, the grade 6, which is the one that you can pretty much put a stethoscope a tiny bit away from the chest wall, and you can still hear the murmur. So this is the old scale, which in fact is the one I still use, and I think most of the cardiology they still use. But now we are there are some papers that are trying to suggest that we can also use a more simpler scale. And the difference is that the soft murmurs were the ones that were grade 1 and grade 2, so the ones that were quieter than the heartbeat. Then the moderate murmurs are the ones that are as loud as the heartbeat, okay? And then the loud murmur is the one that is louder than heartbeat. And then we have the thrilling ones, okay? So that which is grade 5 and grade 6 on the previous scale, okay? Which is pretty much when you have a thrill that you can feel with your hand. So this obviously will be something to look at because one of my tips will be based on this scale, whether they are soft, moderate, loud, or thrilling murmurs. When we have a puppy, okay, that presents to you with a heart murmur, there are a few things that you need to pay attention to decide whether you need to rush and try to book a scan, or you can just wait and monitor the murmur, okay? So I'm gonna give you a few things that you might need to look at on your physical exam. So first thing is trying to get some history from the family of the puppy. There is any other litter mates with a diagnosed heart disease, or any other litter mates with a murmur as well? Were the parents screened for heart disease, particularly if we are discussing, let's say, a breed that is highly predisposed for congenital heart disease? Let's give an example. The French Bulldog is highly predisposed to pulmonary stenosis. Another example, we used to think, or I used to think, that boxers were the #1 for aortic stenosis. Nowadays, we do see much more golden retrievers. Then we need to ask things about, is the puppy playing as you'd expect? Is the puppy being active at home? Is just more quiet than you would expect? Sometimes they have the brother, and the brother is much more active than the one that might have a murmur. So things like these are important for us to decide whether is in fact we should rush in trying to book a scan. And when I'm in rush, it's not like booking on the same day, but there are some congenitals that the sooner we diagnose them, the better, because some of them have surgery. And in some of the pathologies, the sooner we do, the better for the patient as well. And then little things like, is the dog collapsing or not? I didn't put here cough, because in fact, I not tend to see puppies with congenital heart disease with a very large heart coughing. So I think, as you know, there is a bit of controversy about what can cause cough in cardiac patients, but I do agree that they need to have an airway disease if they are coughing because of mechanical compression. So so obviously puppies, they don't have airway disease, so maybe it's because of that I don't tend to see cough in puppies that have a very, very large heart. As I said, breed, very important. Sometimes it's quite difficult to know which breed is predisposed to. Obviously, as a cardiologist, for us, it's quite easy, but you need to remember the most common ones, like French Bulldogs, English Bulldogs for pulmonary stenosis, golden retrievers for aortic stenosis, poodles, Cocker Spaniels, for instance, for PDAs. So it's very important sometimes to have a broad idea, a rough idea of which breed is predisposed to in terms of heart disease as well. Then pulse. Pulse is quite important if it's abnormal. Okay, if it's normal, it doesn't tell you a lot. But if it's abnormal, it might give you some tips, basically. So the most characteristic one is the bounding pulse, okay, or the hyperdynamic pulse. That is the kind of pulse that we feel in PDAs. It looks a really strong pulse. That it sounds like a pulse that we can detect in patients that are really anemic, for instance. Okay, so if you do have a pulse like that, in addition to a loud murmur, because usually PDAs, they cause you a very loud murmur, most of the times with a trill, then you might almost 1% certain that this patient will have a PDA, and potentially you need to refer it quite quickly to have the diagnosis done, and potentially surgical ligation or the closure via minimal invasive surgery. And then if the pulse is weak, okay, and if you have a murmur in a puppy, the first thing that you might need to consider is whether that puppy has aortic stenosis. So aortic stenosis, if it's moderate or particularly if it's severe, okay, they can give you a puppy with a very weak murmur, okay? However, if the murmur is normal, it does not mean that you can rule out aortic stenosis. It's just the fact that severe aortic stenosis can give you a weak pulse, okay? Intensity of the murmur, okay? That's the scale that I just mentioned before. This is very important for us to decide whether we need to rush into trying to arrange a scan, discussing the owner, costs, etc., or we can just tell the owner whether we can monitor it, okay? So this is very important, and I'll let you know later on, like a brief resume of what we can do. But just in a very simple way, the louder the murmur is, the more likely is to be pathological, and the quieter the murmur is, then you still don't know if it can be pathological or non-pathological. But if the murmur is loud, you are pretty much certain that it's very unlikely to be a non-pathological murmur. Timing is also important, okay? So the most common timing terms that we use for murmurs is the continuous, which is most of the times a PDA, okay? So there are not a lot of conditions that can cause a continuous murmur, and most of the times is a PDA that causes a continuous murmur. Then a systolic one is by far the most common type of murmur that you're going to detect, because mostly if the systolic murmurs are not common, and when they are present, it is in fact really difficult to detect them, okay? Even for a specialist, sometimes it can be easily to miss the systolic murmur if that's somehow present. This is important because if you have a continuous murmur, you can right away think about the PTA. If it's systolic, you still don't know just by knowing that it's systolic. You need to add more data to your, you need to collect more data from the physical exam and clinical history to try to decide what you need to do. If it's diastolic, most of the times it's pathological, okay? If you are good enough to detect a diastolic murmur, you are pretty sure that probably is a pathology that is present. We are discussing, obviously, in young patients, puppies. And then really important, localization of the murmur, okay? So it will allow you, by combining the localization and the intensity, you are almost 100% certain of some certain conditions. Okay, let's give an example. So if you have a murmur that is louder in a young puppy, okay? So let's say 4 months old, 6 months old, but the murmur is louder over the left apex, which is the region where we usually detect murmurs due to mitral regurgitation, then very likely you are dealing with a mitral dysplasia, okay? If it's on the base, on the left base, you are still not completely sure. Why is that? Because that's where we're going to detect the non-pathological murmurs, okay? They usually are on the base of the heart. The problem is that on the base, we also have pulmonic stenosis and aortic stenosis. So here, if you have a murmur on the left base, you're gonna, and if the murmur is loud, okay? So if the murmur is, let's say grade 3, or let's say in the most recent scale, moderate or louder, pretty much you are pretty certain that is going to be a pathology, because usually innocent or non-pathological murmurs, they are soft, okay? They usually are soft. If you have like a moderate murmur, you are pretty much certain, okay? Obviously speaking in terms of probability, that is this murmur very likely is going to be pathological if it's grade 3 or higher. And then, very important, if you have a murmur on the base, try always to move your stethoscope quite dorsally, okay, in the armpit of the patient, because a lot of times the PDA can cause, in fact, a very focal heart murmur that is not over the cardiac silhouette. In fact, obviously, the PDA is on between the two great vessels, right? So the aorta and the main pulmonary artery. So in fact, it's a little bit more dorsal than the base of the heart. And sometimes if you are not going there on the specific spot, you might miss a PDA. And missing a PDA can be quite annoying and upsetting for the owner, because if you operate or if you diagnose a PDA quite late, you might have already a lot of cardiac remodeling, and usually it's not nice to tell the owner that ideally that patient should have gone into surgery sooner. So this will be the murmur on the left base. And then also important is to recognize that the right-sided murmurs most of the times are pathological, okay? So usually are caused by ventricular septal defects, tricuspid dysplasia, and sometimes as well pulmonic stenosis, okay? So by only use, even if you don't have the history, even if you don't know what is the breath predisposition, you can combine the localization of the murmur and the intensity of the murmur, and you can have a rough idea even before sending a patient for a scan, and you can tell the owner, is a loud murmur or a moderate murmur is more likely to be something pathological, so probably we need to book. We probably don't need to wait a few months for the scan to happen. But if it's a soft murmur, it can still be, particularly if it's over the left base, it can still be something that might go away with time. Then you can always use other little things that I think they are quite difficult to use in your physical exam. For instance, duration of the murmur, I do not tend to classify it. So I found it quite difficult to make sure that if it is protostolic, cholestolic, etc. But you can use it. The longer the murmur is, the more likely it is to be pathological. So, for instance, a non-pathological murmur will give you usually very short murmurs. Obviously, if there is an arrhythmia, a gallop, that points out that maybe we are dealing with a heart disease, and then jugular distension or pulsation. Obviously, if he's a short-haired patient, you can potentially try to see if you have a jugular distension or pulsation, and obviously that can indicate usually right atrial pressures that are increased, and obviously that means that maybe you are dealing with a pathology. So these are other things that you can look into the physical exam. So when is then, so after saying all this, let's try to resume it, okay? So when is referral recommended? Okay, let's say, give an example, a puppy that is 4 months old, and we are dealing with a murmur in that puppy, okay? First, if it continues, very likely there is a PDA. So we need to try to refer it, not urgently, but try to arrange a scan quite, as soon as possible, basically. If there is a gallop sound on arrhythmia, that means probably an underlying heart disease. So again, very likely to be pathological. So we need to find out what is happening. And then any murmur, as I said before, that is moderate, loud, or thrilling, so moderate or louder than moderate, that probably means that is a pathological murmur as well. So we need to find out what is happening. Right-sided, okay, and left apical. Usually, again, the non-pathological murmurs are on the left base, okay? So if you have a murmur on the right side or on the left apex, that's usually pathological as well. So we need to arrange a scan. Murmurs in puppies that have litter mates without murmurs as well, or already with a diagnosed disease, or let's say a puppy that is already known that one of the parents, let's say, okay, had aortic stenosis, okay, even if he's mild, that probably is a reason to investigate. Bounding pulses, usually they mean a PDA if these are associated with a murmur, okay. Clinical signs, obviously, cardiac clinical signs. And then, as I said, the longer the murmur is, so that's a pansystolic murmur. We have also a diastolic murmur that also means heart disease most of the times. And then any murmur that persists after 16 weeks of age, okay, that is probably something happening with the heart as well. Most of the times is non-pathological, so that those patients should be also investigated. So when is then okay to tell the owner that it might be safe to monitor, and maybe we will do further investigations later on. So any patient with a short systolic murmur, okay, and that is soft as well. So remember I told the non-pathological, they usually are short, soft, and on the left base, and in asymptomatic patients. However, it's very important to remind, okay, that are many other, congenital heart diseases that are much less common, but they might not give you a loud murmur. In fact, they might give you a very soft murmur, or sometimes not even a murmur, okay? So when you tell that to the owner, that will be okay to, just to monitor, always tell the owner that, sometimes you do see patients with congenital heart disease, usually very complex congenital heart diseases, like a very large ventricular septal defect or a very large atrial septal defect that might not even have a murmur, okay? But in fact, they have really bad heart disease. So it's always good to highlight that to the owner, okay? And let's say the owner decides to monitor, okay, what you should advise is to not breathe from that puppy, okay? If the murmur persists beyond 16 weeks of age, this is obviously in a case that the owner decides to not do a scan in this patient. So let's say cannot afford it. So if he cannot afford it, or if he doesn't want to do it for any reason, then if the murmur persists beyond 16 weeks of age, okay, then it's good idea to not breathe from that puppy, okay? And that's it. So these would be the tips that I can provide you from physical exam, from clinical history, and from the type of murmur that you can detect and where it is louder. So you can use these tools to decide if you need to arrange a scan with a cardiologist within the next month or weeks, or is it just okay to monitor and wait for those 16 weeks, let's say. Thanks so much for your attention. Hope this will be useful for you, okay? And as you know, any question, you can always contact VVS and ask all the questions you might have. Thank you.